Cats with chronic kidney disease are constantly losing a lot of fluids through their kidneys. And many times they just can't keep up. They just can't drink enough to maintain hydration. So encouraging them to drink would be nice, but that's really hard to do in a cat. So what we can do is provide fluids subcutaneously or under the skin. That type of therapy is very, very helpful in maintaining normal hydration in these cats.
To counteract dehydration, your veterinarian may recommend subcutaneous fluid therapy, sometimes called SubQ fluids. In SubQ fluids, a special solution of fluids and electrolytes is deposited into the loose pocket under your cat's skin. These fluids will be slowly absorbed into your cat's bloodstream. Subcutaneous fluids may significantly improve your cat's quality of life by increasing appetite and energy level and minimizing constipation caused by dehydration.
The difference it makes in a cat that really isn't feeling well is amazing. And it's a very easy thing you can do to make your cat feel so much better.
Giving subcutaneous fluids is surprisingly easy. Most pet owners quickly become comfortable giving the fluids at home. Begin by gathering the supplies prescribed by your veterinarian. This typically includes a bag of sterile fluids, a drip set, and a sterile unused needle. Make sure the fluid bag is at room temperature so that the fluids will be comfortable for your cat. Open the packaging for the fluid line and remove the cap from the tip of the insertion port. Remove the sleeve from the end of the port on the fluid bag. Without touching the sterile port, push the tip into the bottom of the fluid bag. Hang the fluid bag. Twist and remove the cap from the hub of a new sterile needle. Push the hub of the needle securely onto the end of the fluid line. Remove the needle cover. Open the fluid line by rolling the clamp downward and let the line completely fill with fluids. Reclamp the fluid line and recap the needle as shown to keep it clean. Mark the bag with the amount of fluids you will be giving so you can easily see when you have given your cat the prescribed amount. The fluid set is now assembled and ready for use. Find a good location to give the fluids. Often the best spot is one where your cat will be most relaxed, such as on the couch while you are watching TV, or use a flat surface like the kitchen countertop.
She likes to sleep on my dresser. So I would hang the fluids on the canopy on the bed, which is right next to the dresser, and pet, 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 and she'd go, yeah, how are you doing? And then she'd lay down and she'd stretch out, and I would just lift the skin on the back of her neck and push the needle in, and we would pet, 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 and she'd knead in the air, and she didn't even realize that she was getting fluids, I don't think.
I had a little, just a little budget box, you know, like you pack things in. I'd put a towel in it and put her in, and she'd just sit there.
Don't be afraid to experiment a little to find a place that works best for your cat. Until you become comfortable with the procedure, you may want to ask a friend or family member to help hold your cat.
The first couple times I was very nervous. I had somebody help me because I didn't know how she'd react. But we had a really good relationship, so she let me do anything to her.
Once you have selected a location, hang the fluids. You might want to use a coat hanger to hold the fluid bag. Keep in mind that the higher the fluids hang, the faster they will flow. When you're ready, remove the cap from the tip of the needle, being careful not to touch any part of the sterile needle. Hold the needle at its base between your thumb and forefinger. Using your non-dominant hand, grasp some skin over the neck and gently pull upward to create a little tent of skin. The triangle of skin at the base of the tent is where you will insert the needle down into the subcutaneous pocket. Avoid inserting the needle across the tent, as this can result in the needle going in one side and out the other. In one smooth motion, Pop the needle down into the skin tent. Hold the needle in place by lightly pushing it flat against the skin. Rotate the clamp to start the fluids. As the fluids begin to flow, you should soon see a bulge under the needle where the fluids are accumulating. If the area fills quickly and your cat becomes uncomfortable, it's okay to administer the other half of the fluids in a second spot. When you've given the prescribed amount of fluids, clamp the fluids off and remove the needle. If a small amount of fluid leaks out or you see a little drop of blood, that's normal. Remove the used needle from the fluid line and replace it with a fresh needle for next time. Used needles shouldn't be thrown into your garbage, so ask your veterinarian how you should dispose of the needles. The entire procedure should take about 5 to 20 minutes, depending on the amount of fluids that must be given and the size of the needle used. Afterwards, it's a good idea to give your cat a treat or his favorite reward. This will help him associate the fluids with something pleasant.
Many people are nervous about subcutaneous fluids. What you'll find when you try it is that with proper coaching from your veterinarian or veterinary staff, that it's easy. The cats don't mind at all, and it really does make a difference. This might be the most important thing that you can do at home to help keep your cat alive.
And I was surprised that I did it, and she let me do it. I think that really, really helped a lot.
I think the fluids definitely made her feel better.
The first time you do it, you're going to be nervous and sweating, but once that first time is done, you realize it's an empowering thing. You realize, I can do this, and this isn't hard to do, and it's going to help my cat.